Nursing exam daily practice questions. Question 1. A parent is receiving discharge teaching following their infant's hypospadias repair. Which instruction should the parent follow? Apply a warm compress to the infant's surgical site twice daily. Avoid giving the infant a tub bath for 1 week. Apply an antibiotic ointment to the infant's penis daily. Clamp the infant's catheter for 30 minutes every 4 hours. B. Avoid giving the infant a tub bath for 1 week. Correct answer. In the case of an infant undergoing hypospadias repair, the correct instruction for the parent to follow is to avoid giving the infant a tub bath for 1 week. Option B. This is crucial to prevent infection and ensure proper healing of the surgical site. Immersing the area in water too soon can increase the risk of introducing bacteria and causing complications. Applying a warm compress to the surgical site, option A, is not recommended as it can disrupt the healing process and potentially introduce infection. Applying antibiotic ointment daily, option C, without healthcare provider guidance can also lead to complications such as antibiotic resistance and skin irritation. Clamping the infant's catheter for 30 minutes every 4 hours, option D, is not a standard post-hypospadias repair care practice. Catheter management should be as per healthcare provider instructions to prevent urinary retention and ensure proper drainage. In a pediatric nursing context, providing parents with accurate and clear discharge instructions is essential for the well-being of the child. Understanding and following postoperative care guidelines can significantly impact the infant's recovery and prevent complications, emphasizing the importance of proper education and communication between healthcare providers and parents. Question 2. A child with glomerulonephritis receiving corticosteroid treatment requires dietary teaching. What instruction should the nurse provide to the parent? Increase the child's intake of potassium-rich foods. Encourage the child to eat low-calorie snacks. Offer the child a variety of fresh fruits. Restrict the child's fluid intake. C. Offer the child a variety of fresh fruits. Correct answer. The correct answer is to offer the child a variety of fresh fruits. Glomerulonephritis and corticosteroid use can lead to potassium depletion. Fresh fruits are a good source of potassium, which can help counteract the depletion caused by corticosteroids. Encouraging a variety of fresh fruits can provide necessary nutrients and help maintain a balanced diet for the child. Question 3. A child is being assessed for Kawasaki disease. Which of the following findings should be expected? Decreased heart rate, dry, scaly skin, fever unresponsive to antipyretics, non-tender cervical lymphadenopathy. C. Fever unresponsive to antipyretics. Correct answer. In assessing a child for Kawasaki disease, the correct finding to expect is a fever unresponsive to antipyretics. Option C. Kawasaki disease is characterized by persistent fever lasting more than 5 days, often unresponsive to typical fever-reducing medications. This fever is a hallmark sign of the disease and is crucial for early identification and treatment. Option A, decreased heart rate, is incorrect because Kawasaki disease is associated with tachycardia due to inflammation of the heart and blood vessels. Option B, dry, scaly skin, is incorrect as Kawasaki disease primarily affects the mucous membranes, leading to symptoms like red, cracked lips, and a strawberry tongue. Option D, non-tender cervical lymphadenopathy, is also incorrect as Kawasaki disease is typically associated with tender, enlarged lymph nodes. Educational context. Understanding the key clinical manifestations of Kawasaki disease is vital for pediatric nurses to promptly recognize and intervene in this potentially serious condition. Identifying the characteristic signs and symptoms, such as persistent fever, mucous membrane changes, and lymphadenopathy, is crucial for early diagnosis and appropriate management to prevent complications like coronary artery aneurysms. Question 4. A parent of a preschooler is being taught by a nurse about administering eardrops. Which of the following statements by the parent indicates an understanding of the teaching? I will straighten my child's ear canal by pulling it upward and backward. I will administer the ear drops immediately after removing them from the refrigerator. I will pull the earlobe down and back before administering the ear drops. I will massage my child's ear after administering the ear drops. D. I will massage my child's ear after administering the ear drops. Correct answer. The correct answer is option D. I will massage my child's ear after administering the ear drops. This statement indicates an understanding of the teaching because gentle massage after administering ear drops helps to facilitate the distribution of the medication within the ear canal, ensuring optimal effectiveness. Option A is incorrect because pulling the ear canal upward and backward is not the correct technique for administering ear drops to a child. Option B is incorrect as administering cold ear drops directly from the refrigerator can cause discomfort and may lead to dizziness. Option C is also incorrect as pulling the earlobe down and back is not the appropriate technique for administering ear drops to a child. In the context of pediatric nursing, it is crucial for parents to understand the correct technique for administering ear drops to ensure the safety and well-being of their child. Proper education on this topic can prevent complications and promote effective treatment of ear infections, highlighting the importance of clear and accurate instructions provided by healthcare professionals. Question 5. A healthcare professional is planning care for an infant. Which of the following actions should the healthcare professional include in the plan? Dress the infant in light, breathable clothing. Turn and reposition the infant every 4 hours. Offer the infant frequent, small feedings. Avoid using lotions on the infant's skin. B. Turn and reposition the infant every 4 hours. Correct answer. In caring for an infant with hyperbilirubinemia receiving phototherapy, turning and repositioning the infant every 4 hours is crucial. This action helps ensure even distribution of the phototherapy's therapeutic effects on the infant's skin, aiding in the breakdown of excess bilirubin and preventing pressure injuries. Option A is incorrect as dressing the infant in light, breathable clothing is generally recommended for comfort, but is not as directly related to the effectiveness of phototherapy as repositioning. Option C, offering frequent, small feedings, while important for overall infant care, is not specifically related to managing hyperbilirubinemia with phototherapy. Option D, avoiding lotions on the infant's skin, is important to prevent interference with the effectiveness of phototherapy, but the critical action in this scenario is repositioning to optimize therapy. In an educational context, understanding the rationale behind repositioning in phototherapy for hyperbilirubinemia is essential for pediatric nurses to provide safe and effective care to infants. This knowledge ensures optimal outcomes and prevents complications associated with hyperbilirubinemia treatment. Question 6. When teaching a parent of a toddler with a new prescription for liquid ferrous sulfate, which of the following instructions should the nurse include? Mix the medication with milk. Give the medication with orange juice. Give the medication with meals. Administer the medication with an antacid. B. Give the medication with orange juice. Correct answer. The correct answer is to give the medication with orange juice. Orange juice helps increase the absorption of iron from ferrous sulfate. This acidic environment aids in the absorption of iron, making it a suitable choice for administration. Mixing the medication with milk or an antacid may decrease iron absorption, and giving it with meals may not optimize its absorption as effectively as with orange juice. Question 7. A parent of a child with cerebral palsy is being taught about home care by a healthcare provider. Which statement by the parent indicates an understanding of the teaching? I will perform range of motion exercises twice a day. I will apply a heating pad on my child's legs to reduce spasms. I will allow my child to rest in a recliner for 1 hour each day. I will use wrist splints to maintain alignment. D. I will use wrist splints to maintain alignment. Correct answer. In this scenario, option D, I will use wrist splints to maintain alignment, is the correct statement indicating an understanding of the teaching for a child with cerebral palsy. Wrist splints are commonly used in cerebral palsy to help maintain proper alignment of the wrists and hands, which can improve function and prevent contractures. This intervention supports the child's musculoskeletal health and overall well-being. The incorrect options are A. Performing range of motion exercises twice a day. While range of motion exercises are beneficial for a child with cerebral palsy, the statement lacks specificity regarding which body parts need the exercises and the frequency, which may not be sufficient for effective management. B. Applying a heating pad on the child's legs to reduce spasms. Heat application may not be the most appropriate intervention for managing spasms in cerebral palsy. Other strategies like stretching exercises, medications, or physical therapy are more commonly used. C. Allowing the child to rest in a recliner for 1 hour each day. While rest is important for a child with cerebral palsy, passive rest in a recliner may not address the specific needs of maintaining alignment and preventing contractures associated with the condition. Educationally, it is crucial for parents of children with cerebral palsy to understand the importance of therapeutic interventions like using wrist splints to support their child's physical health and function. Teaching parents the rationale behind each intervention empowers them to actively participate in their child's care and promote optimal outcomes. Question 8. A parent of a school-age child is receiving discharge teaching following a cardiac catheterization. Which of the following instructions should be included by the nurse? Allow the child to bathe 6 hours after the procedure. Keep the child on bed rest for 12 hours. Maintain a pressure dressing on the site for 8 hours. Resume regular activities the day after the procedure. B. Keep the child on bed rest for 12 hours. Correct answer. The correct instruction that the nurse should include is to keep the child on bed rest for 12 hours following a cardiac catheterization. This is important to prevent bleeding at the insertion site and ensure proper healing. Allowing the child to bathe soon after the procedure, maintaining a pressure dressing for only 8 hours, or resuming regular activities the day after the procedure can increase the risk of complications such as bleeding or infection. Question 9. A child is being assessed for possible appendicitis with perforation. Which of the following findings should the nurse expect? Hyperactive bowel sounds, abdominal distension, hypoactive bowel sounds, bradycardia. D. Bradycardia, correct answer. In a child with appendicitis and possible perforation, the nurse should expect bradycardia due to peritoneal irritation. Bradycardia is a common response to peritoneal inflammation or infection, indicating a possible serious complication. Hyperactive bowel sounds, abdominal distension, and hypoactive bowel sounds are more commonly associated with other gastrointestinal conditions and are less likely to be present in a child with appendicitis and perforation. Question 10. When educating a parent of an infant with a new prescription for digoxin, which instruction should the nurse provide? Repeat the dose if the infant vomits. Mix the medication with food. Give the medication with meals. Monitor the infant's heart rate prior to administering the medication. D. Monitor the infant's heart rate prior to administering the medication. Correct answer. In this scenario, option D, monitor the infant's heart rate prior to administering the medication, is the correct instruction to provide to the parent of an infant with a new prescription for digoxin. Digoxin is a medication commonly prescribed for infants with heart conditions to help regulate their heart rate. Monitoring the infant's heart rate before administering the medication is crucial because digoxin can affect the heart rate, and giving it when the heart rate is too low can be dangerous. Option A, repeat the dose if the infant vomits, is incorrect because if the infant vomits after taking digoxin, the dose should not be repeated. It is important to consult a healthcare provider if vomiting occurs to determine the next steps. Option B, mix the medication with food, is incorrect because digoxin should be administered on an empty stomach to ensure proper absorption and effectiveness. Option C, give the medication with meals, is also incorrect because, as mentioned earlier, digoxin should be given on an empty stomach for optimal absorption. Educationally, it is important to emphasize to parents the specific instructions for administering medications to infants, especially ones like digoxin that can have significant effects on the child's health. Parents should be encouraged to ask questions and seek clarification from healthcare providers if they are unsure about how to administer medications properly. This helps prevent medication errors and ensures the safety and well-being of the infant. Question 11. A child has a brain tumor. Which of the following findings should the nurse expect? Decreased head circumference, frequent headaches, increased appetite, increased blood pressure. B. Frequent headaches. Correct answer. Children with brain tumors commonly experience frequent headaches due to increased intracranial pressure. This pressure can result in pain and discomfort, leading to headaches as a common symptom. Other symptoms may include nausea, vomiting, changes in vision, and behavioral changes, but headaches are a prominent feature in children with brain tumors. Question 12. During an assessment, which manifestation should a healthcare provider expect in an infant with pyloric stenosis? Bile-stained vomitus, distended abdomen, olive-shaped mass in the upper abdomen, painless, swollen joints. C. Olive-shaped mass in the upper abdomen. Correct answer. Pyloric stenosis in infants typically presents with an olive-shaped mass in the upper abdomen due to hypertrophy of the pyloric muscle. This mass can often be palpated during an assessment and is a key characteristic of this condition. Bile-stained vomitus may be seen in conditions such as intestinal obstruction. A distended abdomen can be a nonspecific sign of various conditions, and painless, swollen joints are not typically associated with pyloric stenosis. Question 13. A nurse is teaching a parent of a child who has asthma. Which of the following instructions should the nurse include? Use a peak flow meter daily. Administer the medication with meals. Provide a low-carbohydrate diet. Limit exposure to cold air. A. Use a peak flow meter daily. Correct answer. In pediatric nursing, educating parents of children with asthma is crucial for managing the condition effectively. The correct answer is A. Use a peak flow meter daily. This instruction is important because it helps the parent monitor the child's lung function and asthma symptoms at home, enabling timely intervention and better control of the condition. Option B. Administer the medication with meals is incorrect because the timing of medication administration is specific to each medication and should be determined by the healthcare provider. It is not a universal rule for all asthma medications. Option C. Provide a low-carbohydrate diet is also incorrect as there is no direct link between asthma management and carbohydrate intake. A balanced diet is important for overall health, but does not specifically impact asthma symptoms. Option D. Limit exposure to cold air is a good general advice to prevent asthma exacerbations triggered by cold air, but it is not as essential as daily peak flow meter use for monitoring asthma control. Educationally, teaching parents about the daily use of a peak flow meter empowers them to actively participate in their child's asthma management, leading to better outcomes and decreased emergency room visits. It enhances their understanding of the condition and promotes proactive monitoring, which is key in pediatric asthma care. Question 14. A child is in the oliguric phase of acute kidney injury. Which of the following interventions should be included in the plan of care? Administer a loop diuretic. Provide a low-sodium diet. Weigh the child weekly. Provide a high-protein diet. A. Administer a loop diuretic. Correct answer. During the oliguric phase of acute kidney injury, the priority is to manage fluid balance. Administering a loop diuretic helps promote diuresis and reduce fluid retention, aiding in managing the condition effectively. Providing a low-sodium diet may be beneficial, but is not the priority intervention during this phase. Weighing the child weekly may be important for monitoring overall health, but does not directly address the oliguric phase. Providing a high-protein diet is not typically recommended in acute kidney injury, especially during the oliguric phase. Question 15. When caring for an infant with respiratory syncytial virus, RSV, which of the following actions should the nurse take? Administer antibiotics IM once per day. Initiate droplet precautions. Place the infant in a negative pressure isolation room. Suction the nasopharynx as needed. D. Suction the nasopharynx as needed. Correct answer. When caring for an infant with respiratory syncytial virus, RSV, maintaining a patent airway is crucial. Suctioning the nasopharynx as needed helps clear secretions, prevent airway obstruction, and promote effective breathing. This intervention can aid in improving the infant's respiratory status and overall comfort. Question 16. A healthcare professional is preparing to administer a. Which of the following findings is a contraindication to the administration of this vaccine? Family history of egg allergy. Currently taking antibiotics. History of asthma. Presence of rhinorrhea. B. Currently taking antibiotics. Correct answer. In the case of administering the measles, mumps, and rubella (MMR) vaccine to a 15-month-old child, the correct answer is B. Currently taking antibiotics. This is a contraindication because live vaccines, such as the MMR vaccine, may have reduced effectiveness when administered concurrently with antibiotics. Antibiotics can interfere with the body's ability to mount a proper immune response to the vaccine, potentially reducing its efficacy. Option A, family history of egg allergy, is not a contraindication to the MMR vaccine. While the vaccine is grown in chick embryo cells and individuals with severe egg allergies should consult with their healthcare provider, most children with egg allergies can safely receive the MMR vaccine. Option C, history of asthma, is also not a contraindication to the MMR vaccine. Asthma is not a contraindication for any routinely recommended vaccine. Option D, presence of rhinorrhea, which is a runny nose, is not a contraindication to the MMR vaccine. Mild illnesses, like a runny nose, do not typically interfere with the administration of vaccines unless the child is significantly unwell. Educationally, it is crucial for healthcare professionals to understand contraindications to vaccines to ensure safe and effective vaccination practices. Knowing the specific contraindications for each vaccine helps prevent adverse reactions and ensures that children receive the full benefit of immunization. It is also essential to stay updated on vaccine guidelines and recommendations to provide optimal care for pediatric patients. Question 17. A healthcare professional is assessing a child who has nephrotic syndrome. Which of the following findings should the healthcare professional expect? Hypotension, hyperglycemia, facial edema, weight gain. D. Weight gain. Correct answer. In nephrotic syndrome, there is increased permeability of the glomerular filtration barrier, leading to protein loss in the urine. This results in hypoalbuminemia, causing fluid retention and edema. Therefore, weight gain due to fluid retention is a common finding in children with nephrotic syndrome. Question 18. A caregiver is teaching a parent of a child with a new prescription for ferrous sulfate tablets. Which of the following instructions should the caregiver include in the teaching? Give the medication with milk. Take the medication on an empty stomach. Avoid giving the medication with orange juice. Brush the child's teeth after administration. D. Brush the child's teeth after administration. Correct answer. The correct answer is D. Brush the child's teeth after administration. When teaching a parent about administering ferrous sulfate tablets to their child, it is essential to emphasize the importance of brushing the child's teeth after giving the medication. Ferrous sulfate can cause teeth staining, so brushing immediately after administration helps prevent this side effect. Option A. Giving the medication with milk is not recommended as it can decrease the absorption of iron from the ferrous sulfate tablets due to the calcium in milk binding to the iron. Option B. Taking the medication on an empty stomach is a common instruction for some medications to enhance absorption, but in the case of ferrous sulfate, it is better tolerated with food to reduce the risk of gastrointestinal upset. Option C. Avoiding giving the medication with orange juice is important because vitamin C in orange juice can enhance iron absorption, potentially increasing the risk of iron toxicity if not monitored closely. In a pediatric nursing context, educating parents about medication administration is crucial for ensuring proper treatment and minimizing side effects. Emphasizing specific instructions like brushing after giving ferrous sulfate tablets helps parents feel confident in caring for their child's health. Question 19. A nurse is planning care for a school-age child who has thrombocytopenia. Which of the following interventions should the nurse include in the plan? Administer aspirin as needed for fever. Avoid venipunctures whenever possible. Encourage the child to participate in contact sports. Administer ibuprofen for pain. B. Avoid venipunctures whenever possible. Correct answer. In caring for a school-age child with thrombocytopenia, which is a condition characterized by low platelet count and increased risk of bleeding, the nurse should prioritize interventions that minimize the risk of bleeding. Option B. Avoiding venipunctures whenever possible is the correct intervention to include in the plan. Venipunctures can lead to bleeding in children with thrombocytopenia, so minimizing unnecessary invasive procedures is essential to prevent complications. Option A, administering aspirin for fever, is incorrect because aspirin can further decrease platelet function and increase bleeding risk in these patients. Option C, encouraging participation in contact sports, is also incorrect as contact sports increase the risk of injury and bleeding, which is not safe for a child with thrombocytopenia. Option D, administering ibuprofen for pain, is not the best choice as ibuprofen can also affect platelet function and should be used cautiously in children with low platelet counts. Educationally, this rationale highlights the importance of understanding the specific needs of children with thrombocytopenia and the significance of implementing interventions that promote their safety and well-being. It underscores the nurse's role in providing holistic care and minimizing risks associated with the child's condition. Question 20. A child with sickle cell anemia is experiencing a vaso-occlusive crisis. Which of the following actions should the nurse take? Administer meperidine for pain. Apply cold compresses to the child's joints. Limit the child's fluid intake. Maintain bed rest for the child. D. Maintain bed rest for the child. Correct answer. During a vaso-occlusive crisis in sickle cell anemia, maintaining bed rest is crucial to reduce oxygen consumption and alleviate pain. Movement can worsen the crisis by increasing sickling of red blood cells, leading to further tissue damage and pain. Bed rest helps to improve blood flow, reduce pain, and promote healing. Question 21. A parent of an infant with gastroesophageal reflux is being taught by a nurse. Which of the following instructions should the nurse include in the teaching? Offer the infant feedings every 2 hours. Position the infant upright after feedings. Feed the infant thickened formula. Place the infant. B. Position the infant upright after feedings. Correct answer. The correct answer is B. Position the infant upright after feedings. This instruction is crucial in managing gastroesophageal reflux in infants. By keeping the infant upright after feedings, gravity helps to keep the stomach contents down and reduces the likelihood of reflux. This position also aids in digestion and decreases the chances of regurgitation and aspiration. Option A, offering feedings every 2 hours can exacerbate reflux by overloading the stomach with too much food, leading to increased reflux episodes. Option C, feeding the infant thickened formula is not recommended as it can increase the risk of aspiration and does not address the underlying issue of reflux. Option D, placing the infant in a prone position after feedings is dangerous as it increases the risk of aspiration and sudden infant death syndrome, SIDS. In the educational context, it is important for nurses to provide evidence-based instructions to parents on how to manage gastroesophageal reflux in infants. By explaining the rationale behind positioning the infant upright after feedings, nurses empower parents to actively participate in their child's care and promote positive health outcomes. Question 22. A parent of a child with attention deficit hyperactivity disorder, ADHD, is being taught by a nurse. Which instruction should the nurse include in the teaching? Administer methylphenidate at bedtime. Increase stimuli in the child's environment. Administer an extra dose of medication if the child is overactive. Maintain a consistent bedtime routine. D. Maintain a consistent bedtime routine. Correct answer. In pediatric nursing, educating parents of children with ADHD is crucial for effective management. The correct answer, option D, maintain a consistent bedtime routine, is essential in managing ADHD. Consistency in bedtime routines helps regulate the child's sleep patterns, which can positively impact their behavior and attention span. Option A is incorrect because administering methylphenidate at bedtime can disrupt the child's sleep, leading to further behavioral issues. Option B suggesting increasing stimuli is counterproductive as children with ADHD often benefit from a structured and low-stimulus environment to help them focus. Option C of giving an extra dose of medication if the child is overactive is not safe and can lead to potential overdose or adverse effects. Educationally, teaching parents about the importance of consistency, structure, and routines in managing ADHD provides them with practical strategies to support their child's well-being and behavior. This instruction empowers parents to create a stable environment that can positively impact their child's ADHD symptoms and overall quality of life. Question 23. A nurse is teaching a parent of a child who has type 1 diabetes mellitus. Which of the following statements by the parent indicates an understanding of the teaching? I will notify my child's school about his condition. I will encourage my child to eat a carbohydrate snack if his blood glucose is low. I will rotate injection sites each time I give my child insulin. I will ensure my child receives the flu vaccine every year. C. I will rotate injection sites each time I give my child insulin. Correct answer. The correct answer is C. I will rotate injection sites each time I give my child insulin. This statement indicates an understanding of the teaching because rotating injection sites helps prevent lipodystrophy, a condition where fatty tissue under the skin becomes lumpy or hollow due to repeated injections in the same area. By rotating sites, insulin absorption remains consistent, leading to better glucose control. Option A is incorrect because while notifying the school is important, it does not specifically address diabetes management at home. Option B is incorrect as giving a carbohydrate snack for low blood glucose is a good practice, but it doesn't demonstrate an understanding of insulin administration. Option D is incorrect as the flu vaccine is essential for children with diabetes, but it doesn't directly relate to insulin administration. In a pediatric nursing context, teaching parents about insulin administration is crucial for managing type 1 diabetes in children. Understanding proper injection techniques and site rotation can prevent complications and ensure effective treatment. Parents play a vital role in their child's diabetes care, and empowering them with correct information is key to successful management. Question 24. A parent of a toddler with congenital heart disease is being taught by a nurse. Which of the following instructions should the nurse include? Offer small, frequent meals. Limit the toddler's physical activity. Provide a low-sodium diet. Monitor the toddler's intake and output. A. Offer small, frequent meals. Correct answer. In pediatric nursing, educating parents of children with congenital heart disease is crucial for managing the child's health effectively. The correct answer, A. Offer small, frequent meals, is important because children with congenital heart disease may have difficulty eating large meals due to their condition. Small, frequent meals can help prevent overeating, reduce the workload on the heart, and maintain stable energy levels throughout the day. Option B, limit the toddler's physical activity, is incorrect because while some restrictions may be necessary, depending on the severity of the condition, complete restriction can lead to deconditioning and may not be appropriate for all children with congenital heart disease. Option C, provide a low-sodium diet, is not the most relevant instruction for a toddler with congenital heart disease. While sodium intake may need to be monitored, other dietary considerations, such as calorie and nutrient density, are often more critical in this population. Option D, monitor the toddler's intake and output, is important in general pediatric nursing care, but is not as specific or directly related to managing congenital heart disease in a toddler as the recommendation for small, frequent meals. Educationally, this question highlights the importance of tailoring dietary recommendations to the specific needs of children with congenital heart disease and the significance of providing parents with practical guidance to support their child's health. Question 25. A nurse is caring for a child who has a new diagnosis of osteomyelitis. Which of the following actions should the nurse take? Administer aspirin for pain. Apply ice to the affected area. Monitor the child's weight daily. Limit the child's activity. C. Monitor the child's weight daily. Correct answer. In this scenario, the correct answer is C. Monitor the child's weight daily. Osteomyelitis is a serious infection of the bone, and monitoring the child's weight daily is crucial in assessing their nutritional status and overall health. Weight changes can indicate disease progression or response to treatment, so close monitoring is essential. Administering aspirin for pain, option A, is contraindicated in children with viral infections like osteomyelitis due to the risk of Reye's syndrome. Applying ice to the affected area, option B, is not appropriate as it can worsen the infection by vasoconstriction and reducing blood flow to the area. Limiting the child's activity, option D, may be necessary in some cases to prevent further complications, but it is not the priority in this situation. From an educational standpoint, understanding the importance of monitoring a child's weight in conditions like osteomyelitis helps nurses provide holistic care. It emphasizes the significance of ongoing assessment and the role of nursing interventions in managing pediatric patients with complex health needs.